Hello, my name is William McMillan, and today I'll be informing you about the job of a nurse anesthesiast. I'll be going over the schooling that is required, its pay and how many hours they will work, some of the responsibilities they will face, and then the mental health that a nurse anesthesiast will have. First off, I'll talk about what kind of schooling is required for a nurse anesthesiast. The usual path is to get a bachelor's of science in nursing, and then get around a year of experience as a nurse, and then finally a master's in nurse anesthesia. This does fluctuate from state to state and from hospital to hospital. I've also read that some hospitals and schools require 2 years of experience and a doctorate in nurse anesthesia. Some of the top schools with nurse anesthesia programs include Baylor, Duke, Iowa, and Houston. A nurse anesthesiast in Texas on average makes $232,191 annually. Typically, they will work 2 24-hour shifts per week. There are some settings where they might work 8 to 12-hour shifts, however, the full day is the most common. Now I'll be going over some of the responsibilities that a nurse anesthesiast will have while on the job. First off, one of the main ones is that they'll be preparing patients for anesthesia. This includes a physical assessment prior to the surgery and preoperative teaching. Preoperative teaching being what you will tell the patient about the surgery and what occurs afterwards. The next responsibility is pretty obvious. It's actually in the name. They would be administering anesthesia. Building off of this, they would also be maintaining the level of anesthesia throughout the surgery to ensure that the patient doesn't wake up, feel pain, or have any complications related to anesthesia. They would also ensure that proper care is given to the patient after surgery and that they are able to wake up from the anesthesia on schedule. They also have the usual nurse responsibilities while they are not in surgery. This includes the usual care of patient while they have their stay at the hospital, administering medicine, drawing blood, and aiding doctors in any way that they can. This can include bedpans, IV bags, anything that you honestly see in a nursing show. Lastly, I'll take a look at the mental health perspective of being a nurse anesthesiast. Although it is very rewarding and grateful to be one, it is also highly stressful. You have the life of another human being all in your hands. If you were to mess up, make one mistake, or anything, even lose focus, you could lose that patient, lose your job, and be in jail. The long hours also end up taking a toll on you and can be very taxing on your mental health. Working all that time with all that stress is never great. Most nurse anesthesists end up needing a therapist or just having someone to talk to outside of it, and some can't even last to complete their job fully. However, if you manage the stress during surgery and build a schedule that works for you, you can be very happy with your job. Most nurse anesthesists that have made it past their first 5 years in schooling and on the job have actually shown to be very happy with their life and very happy with their career. That concludes the speech and information I have covered. I went over the schooling requirements, the details of the job responsibilities, and took a look at how nurse anesthesia's mental health is. Thank you for listening to my speech about the information of nurse anesthesia and going over it, and have a good day.